Cognitive behavioral therapy, commonly known as CBT, is a form of psychological treatment that's been proven effective for many conditions, including depression, anxiety disorders, marital issues, eating disorders, and severe mental illness. Often used to break down overwhelming problems into smaller, manageable parts, CBT can help change negative thought patterns that lead to destructive behavior. It establishes a connection between one's thoughts, emotions, and actions, creating an awareness of how misconceptions can lead to harmful actions. Hence, fostering a positive step towards mental health and well-being. Through CBT, individuals gain a better understanding of how their cognitive distortions, their misperceptions of reality, can lead to anxiety and depression. A deep understanding of anxiety and depression is crucial to manage these conditions effectively. Anxiety is marked by constant worry and fear, while depression is characterized by persistent sadness and loss of interest in activities once enjoyed. These disorders affect not only our emotional state, but they also significantly impact our thought process and behavior, influencing how we perceive ourselves and the world around us. Unmanaged anxiety and depression can lead to harmful consequences, like loss of productivity, relationship problems, and even physical health issues. Therefore, understanding and managing these disorders is important. Strategies, like cognitive behavioral therapy, are key to breaking the cycle of negative thought patterns and alter maladaptive behaviors. In the landscape of mental health, cognitive behavioral therapy plays a pivotal role, especially in managing anxiety. It does this through specific, grounded techniques such as cognitive restructuring and exposure therapy. Cognitive restructuring is the process by which CBT helps you identify, challenge, and ultimately alter harmful beliefs and thought patterns. On the other hand, exposure therapy is a technique wherein individuals are gradually exposed to anxiety-provoking situations until they become less frightening. This reduces avoidance behavior, which can perpetuate anxiety disorders. With these techniques, CBT promotes change in the coping mechanisms of individuals, effectively managing their anxiety, and opening the doorway to improved mental health. Cognitive behavioral therapy, or CBT, offers a tangible approach to managing depression. It introduces techniques like behavioral activation and identification of cognitive distortions. Behavioral activation aims to help individuals engage more frequently in enjoyable activities and build positive interactions with their environment. It helps combat the inertia and social withdrawal often associated with depression. Identification of cognitive distortions is another central technique in CBT, where individuals learn to recognize distorted, negative thinking patterns, the glasses through which they see the world, and replace them with more realistic and positive ones. The overall aim of CBT in managing depression is to equip individuals with effective skills to combat depressive symptoms, giving them concrete tools to build a more positive life. Some of the most compelling evidence for the efficacy of cognitive behavioral therapy comes from real-world case studies. These stories of individuals who have successfully undergone CBT help illustrate its potential in tangible ways. From overcoming crippling anxiety to dealing with deep-seated depression, these stories show how CBT techniques such as cognitive restructuring and behavioral activation made a significant difference. However, it's important to note that every CBT journey has its own unique challenges. Adapting to new ways of thinking and reacting to situations is not always easy, but with determination, time, and effort, the benefits can be life-changing. These case studies not only offer insight but inspire hope for those embarking on a similar journey. In conclusion, cognitive behavioral therapy is a powerful tool in managing anxiety and depression, fundamentally altering how we understand and respond to these conditions. By reshaping thought patterns and behaviors, it steers towards healthier ways of coping. If you're seeking help, it's invaluable to remember that engaging with treatment requires patience and steadfastness, as change is a process, not an event. Additionally, don't hesitate to seek professional help if you need it. There are numerous resources available, both online and offline, that can offer assistance. Mental health professionals trained in CBT can provide guidance and support for individuals on this journey. Remember, it's not just about surviving, it's about thriving.